really happy now to start the panel sessions by handing over to Professor Martin Webber. Martin is Professor of Social Work at the University of York, and he's also Director of the International Centre for Mental Health Social Research. So Martin, I'm thrilled to say, is going to be chairing the first panel session. Martin's been involved with Think Ahead since its inception, so is incredibly well placed to think about this important topic about the future of the profession and how it's going to respond to both the challenges of the pandemic, but also digital innovation. So Martin, over to you and your illustrious panel.
Thank you very much, Ella. Thank you very much for the invitation to chair this session. It really is an important topic and an important time to consider these issues. I was just reflecting on digital innovation in social work, and 25 to 30 years ago, we may have had one computer in the office and a long line of practitioners waiting to input their case records onto it or to look something up. Things have changed radically over that time. Not just in the last year, it's been a long, steady progress up to where we are now. But the last year has really highlighted the fact that digital is central to our role. Now, many of you will have stopped going into the office and stopped going out on home visits and just spent all of your time in front of the computer or on the telephone. Others have continued to work in the community. But what we know is that this format of communicating, meeting with one another has become the norm, which is a real challenge to us as social workers within a relationship-based profession where face-to-face contact is at the heart of what we do, what we're passionate about. So it really does require us to innovate, to think differently, to be creative. And I have witnessed some amazing innovation over the last 12 months, some real passion within the profession to serve, to challenge social injustice, and to keep the profession moving forward. And it's really just some of these themes that we're tapping into within this panel discussion today. Now, I'm not quite sure why I've been asked to chair this. I'm not exactly the most digital person out there. I still punctuate my texts. I'm still not sure what aubergine emojis are all about. Only joking, of course. I do punctuate my texts, but other than that, I mean, I'm not into Snapchat and Instagram. Using a little bit of Twitter and Facebook here. You know, I'm telling you can tell my age just by the social media that I use. But the people that we do have on the panel, though, have some expertise and can say a lot more than I can about this subject. Each is going to speak for 5 minutes, and I'm going to introduce them one at a time. During the session, while they're speaking, please do post questions in the Q&A function. And like any good social media function, you can like other people's questions, and that boosts them up the list. So it's more likely that I will have a look at the questions which get boosted up by the like function. But I will dip down the list in the Q&A afterwards to make sure that some of those more niche questions, which maybe don't have all of the likes, also get a mention as well. We won't have time to deal with every single question, I'm afraid, but please do like the ones that you want to be answered. Right, enough from me. Introducing our first speaker, Mark Trewin. Mark is the Mental Health Social Work Lead at the Department of Health and Social Care, working in the Office of the Chief Social Worker. Over to you, Mark.
Thank you very much, Martin. And you're not old at all. Don't put yourself down there. I see you on Twitter. You know what you're doing. But it's absolutely lovely to be asked to speak on this subject today. And as Martin said, I'm the Mental Health Social Work Lead at the Department of Health and Social Care, and I work in the Office of the Chief Social Worker. And so that kind of has given me this fantastic opportunity to have an overview of mental health social work over the last couple of years, and particularly the last year as we've all coped with the COVID pandemic. And so I wanted to talk about how COVID has affected what we do, and the opportunities but also risks of working in a digital way. Because one of the things that COVID has shown us is that social work, and the same can be said of nursing and other professions as well, has been absolutely brilliant at responding to an emergency. Ruth was talking about some of the work that she's done with BASWA, and some of that she's done jointly with me and the AMP Leeds network. And we've looked, for example, at how AMP services across the country have responded to COVID. And the overarching theme of that report was that AMP services just turned their services upside down in a very short period of time, redesigned it, re-evaluated the way that they were working, and continued to offer as good a service as they possibly could to the people in their communities. It was very, very impressive. However, digital has given us the opportunity to work in different ways, and many of us are now working almost wholly digitally in terms of our day-to-day work. But it has also presented us with some problems as well. So to go through some of the advantages and disadvantages of digital, and some of the opportunities and risks. So for a start, I think that we have to understand a concept called digital poverty. Many of us in social work talk about lack of inclusion and exclusion in many different ways. And of course, there are large numbers of people who don't have access to digital. I think there's estimates that about 9 million people do not have any access to the internet whatsoever. And of the people who do, about 16% often need help and support in accessing it usually. And that means that if we change from a non-digital to a digital way of working, we are at risk of missing out large numbers of people. Now, one of the lessons of the COVID experience, for example, is not just that we've done a great job in changing the way that we work, although that's true. It's also that we have stopped seeing people face to face, and lots of people have found that very, very difficult. And perhaps one of the lessons of the COVID period is that many of us in mental health were too quick to stop seeing people face to face. And many of you in mental health will also know that there's been a recent judgment, what's called the Devon case, which has explored how social workers and AMPs in particular have worked with the Mental Health Act. And this is another particular problem that we've got, is a lot of our legislation is quite old and was produced before people had access to digital, and so is not included in the legislation. So one of the things we will need to do if we're going to use digital properly is to be able to work with across a range of legislation in order to modernize it, to make sure that the pitfalls and issues of working with digital are not confounded. However, there are advantages as well. Large numbers of young people use mobile phones and digital, and often prefer to be contacted in this way. Large numbers of people with mental health issues find being contacted digitally much safer and much easier to access than face-to-face working. We need to change our community mental health services from ones that are based on buildings where people visit, secure buildings with security where people visit when we tell them to community services based on a place-based concept where we work with families and individuals in their community, and where we support and wrap care around the person rather than expecting the person to come and get their care from us when we decide. So that, I think, is a massive challenge, and I think digital can really help us with this. I know of quite a few projects across the country that are engaging with young people in CAMS and young people with a mental health problem by using digital. So we have this huge opportunity to completely change the way that we work, but also to be aware of the risks and pitfalls as we do so. One of the things that I would say, one of the major mistakes that I think we've made before COVID is to use digital in many areas as something that is quite dull and something that is around recording visits with people rather than engaging with people. So almost every mental health social worker in the land will be recording their assessments and their care plans and their visits to people on a digital system in a way that often makes them feel they're spending too much time in the office and not enough time engaging with humans. And I think this is one of the problems, that digital is now seen as being that kind of way of working across the country. And we have to change that, actually. We have to use it as a tool that can be creatively used to engage with people, particularly young people, particularly people from Black and ethnic minority backgrounds who don't normally engage with mental health services as they are at the moment. So I will leave you with that final positive thought. Go back to Martin, to the next speaker. So thanks very much for listening.
Excellent. Thanks so much, Mark. That's a really, really important point to end on. And it links in with what Ruth was saying about our roles within communities and social workers working much more within communities and not offices. And can we in some way use digital to enhance community engagement is a big important question for us to answer. So next I'd like to introduce Hameed Khan, who worked on the NHS Confederation report on digital inclusion in mental health with Mark. So there's a nice segue there. And Hameed is an ex-service user, carer, and community mental health activist. Over to you. Thank you very much.
Thank you, Martin. Hi, I'm Hameed Khan, and as Mark mentioned about data poverty, I will also briefly touch upon that as I think one of the things that came out from the pandemic is that we realize how important digital skills are. I didn't actually feel digitally incompetent until the pandemic took place. And my first experience is a professional contacting me and saying, we will be doing your appointment online rather than face to face. And that came to me as a shock because I was like, how does an appointment take place online? It's better than not having an appointment at all. At least you're getting an interaction and you're getting the service, but the quality of the service is under question mark because you are the professional is relying on the information you're conveying. When you see me face to face, and I'll apply to social work context, if you're seeing a service user face to face, you can pick up many aspects through body language, tone of voice, the way they're appearing, the state of their home, many factors that could give you a better picture. When you're relying on screen, I can portray what I want to portray. So I can mask the actual emotions and not give a real picture of the services I need and the support I need. Or I could, on the other hand, exaggerate my condition in order to um, get services a lot quicker or be seen as a priority. So it kind of leaves that kind of question mark about, are we getting the real true picture of what the person is going through or is feeling. I want to now relate it to the project, the confederation of the project that was carried out about digital inclusion. And I think what I want to just quickly say is that what I had realized very quick, that in the 80s, most people who couldn't speak English felt very illiterate, in the sense if you didn't know English, you couldn't access services, employment, and many other things that you do to be a citizen. And now English is not just the only barrier that people face. Even if you can speak very fluent English, you're very articulate, but if you don't have digital skills, you face exclusion on many layers. And that could be from accessing a service to um, showing and taking part in activities, to be a real true citizen of, even just if you think about it from a very basic point of view, nowadays it's more encouraged to do online voting. Now, most people who don't have digital skills can't online vote. So even at a level of having your vote counted through digital mechanism, if you don't have the skills, you're automatically not being able to access that platform. And relating this to social work, what I had realized is that what was happening is that it's not just about digital skills, it's also about digital items and devices that you need, in the sense that, are they, first of all, compatible for whatever program? One of the things that frustrated me, and one of the things I raised with the NHS, and I said, why is it that different professionals are contacting me and yet I have to use different platforms to communicate with them? One minute I've got to become a competent in using Zoom. Next minute I've got to become competent using Microsoft Teams. Then you've got Slack, then you've got WhatsApp, then you've got, and there's so many more I could mention. So why can't the NHS just develop one universal platform that is used across England and Wales? So every time you have an NHS appointment through the online, you know it's exactly the same digital platform that's going to be used. And I think the same could apply to social work, that social work across, maybe Social Work England could take on this as a project to campaign or develop or create one platform for communicating with their service users and carers. So me as a carer and also as a service user don't have to keep working out which one is it that I need to go on today, which one is it that I need to get competent in. So that's something. But also on top of that, we need to recognize as inclusion, there's a real cost. And when I say digital inclusion doesn't just happen because I have a laptop and I can use it. It's also the real cost of it. First of all, if you only got one laptop and there's 5 family members, what about privacy? What about data? I don't want everything about me, another member of my family be reading, but it doesn't offer that privacy when you only have one device that has to be used across different family members. Then also the aspect of that not everybody's got a place in the home where they could have a private corner without any distractions, without any kind of interruptions, where they can have quality of the appointment. And also data poverty is it's a real issue. We assume that everybody has Wi-Fi. We assume that everybody's got good fast Wi-Fi, and actually that's not the case. And one of the things that I'm very ambitious about, and it may come across silly, but there's common sense in what I'm about to say. When I was in Armenia and I was walking through a public park, and somebody said to me, oh, in Armenia, you can get free Wi-Fi wherever you are. And I was really surprised and said, what do you mean? And they said, well, actually, we have an American singer who's Armenian that funds free Wi-Fi in our country. So what I'm kind of campaigning and saying is, why can't we pay £50, £100 extra a year in our council tax, and everywhere in the UK across the board, there is free Wi-Fi? Because that is what I call real inclusion when it comes to digital world. It's about known faces, the barrier. Asylum seekers and refugees who access social work services are completely struggling in the pandemic because where do they go? Public buildings are closed where they used to access free Wi-Fi and computers. So who do they go to? Where do they go to get the access? So what I like to say on my last point is that the digital inclusion project that I was involved with at the NHS, and it was great to work with somebody who was a great lead on it, Alex Stewart. And one of the main common issues that came across was that train service users about how to use digital platforms. Secondly, is don't make assumptions that everybody can just learn by themselves, and also look at understanding data poverty. And for that, there's a great organization called Here Equality. Please, if you get a chance, they are wonderful. They're doing a lot of work around looking at digital inclusion. And they also have another project underneath that called Digital Inclusion for London Network, DILN. And I love being part of that because it's where we can really say and get ourselves heard, because they then contact the people who are in power to say, this is one of the barriers that need to be addressed. So finishing on that, social work is great that we were offered services through online during the pandemic, but not as good as it could have been because it hadn't been thought through what services and carers face as barriers. Thank you.
Thank you so much, Hameed. The really important point that you've made there around digital inclusion is something that should be taken up by the profession, but more importantly by politicians, that there is a real inequality here and it needs to be addressed. So thanks for highlighting that. Let's move to our third speaker, Jan McIntosh, who kind of exemplifies the new use of technology and digital innovation in mental health social work. He juggles 2 jobs as a mental health social worker and chief executive of Knack, which is a well-being focused craft subscription box plus interactive workshop. He's also an alumnus of Think Ahead and the University of York. So welcome, Jan.
Thank you, Martin, and good morning, everyone. As Martin said, my name's Jan McIntosh, and it's great to be here to talk about innovation in social work and to tell you a little bit more about the digitally focused social venture that I co-founded in late 2019, Knack. I want to firstly say a big thank you to Think Ahead for putting on the conference today, but for also bringing me and my co-founders together. We actually met in the first week of the program, and having all worked in adult social care before, we quickly got talking about ways that we felt the system could work more creatively with clients and bringing more digital solutions into practice, specifically enabling people to have more choice and control around the type of social activities they do and increase the opportunity for them to connect with other people who have similar interests. In 2019, we finally took the plunge and left our social work roles, to start our own social venture. And although COVID-19 made us have to pivot away from our original concept, which had people connecting face to face, we're really happy with our current offering. So our overall aim is to improve people's well-being through the power of regular creative activities, which research shows can have a positive impact on helping people feel more relaxed and improving their self-esteem. Creative activities such as crafts are extremely popular, particularly amongst women, and the 73% of women actually tried at least one craft in the last year. But our research showed that there are several barriers to people actually regularly getting involved in this type of activity and even attending workshops where they can learn new skills. One of those being time and effort to actually get all the items you need to get involved and do the craft, high cost of actually doing this, the lack of interesting activities in their local area or workshops that are available, and actually some anxiety about attending craft workshops on their own. So what we wanted to do is find a way to overcome some of these barriers and decided on a kind of hybrid digital in-person product. So Knack is a craft subscription box with a monthly interactive online workshop, which is held via Zoom and run by a craft expert, which we partner with each month. We make it easier and more cost effective for people to get creative on a regular basis by sending out all the items they need for each project and helping them to actually get expert tuition in real time from anywhere where they're based in the country. Moreover, we enable people to interact with other attendees, allowing them to meet people from all across the country who have similar interests to them. What makes us a bit different to other craft boxes is that each month our members actually vote on the next project they'd like to see. And this ensures that we have a wide range of projects which suit the diverse interests of our users. Really happy to say that we now have just under 200 monthly subscribers from all across the UK who receive a Knack box every month and have sent out just over 1,000 boxes since we launched last May. But what we're most excited about is the impact that our workshops are having on our users' well-being. So we collect data before and after our workshops to kind of see how people's feelings about things have changed. And what we've managed to see is an increase in people's feelings of their own creativity by about 20%, a 24% increase in people's feelings of their own relaxation after the workshops, and really interestingly, and I think most impactfully, a 31% increase in people's feelings of connection to others with similar interests, showing that actually you don't have to necessarily always have to be face-to-face to still feel those connections with other people. We see this as proof of impact, and we recently started to push to start trying to reach people who traditionally report experiencing poor well-being and isolation. So last month we began a pilot delivering private workshops for members of Carers UK, and our early feedback has shown that they're benefiting from the workshops in a similar way to our main membership. In the coming months, we'll be trying to raise some more money to grow the business and our offering, and particularly looking to work with more charities, local authorities, and the NHS to bring our creative classes to even more people across the country. Thank you very much.
Thank you so much, Jan. It's really interesting, and it's demonstrating how social enterprise and social work could go hand in hand as a potential option within the future to diversify what we do. And it's great to hear some really positive outcomes from your work so far. So thank you, Jan. Moving on to our final panel member, Arnold Thornton-Rice, also a Think Ahead and University of York alumnus, currently working in Coventry's early intervention team. He's currently seeking publication for his research on social work, privacy and social media, which explores how practitioners are dealing with new ethical challenges posed by an increasingly digital world. So welcome, Arnold.
Hello, thank you very much, Martin. Yeah, so my kind of angle, I guess, is slightly different from some of the other guys on the panel, but it picks up a little bit on what Hameed touched on with privacy, because this was really key to the research I did as part of the Masters on Think Ahead. Now, the title of my research was The Invisible Frontier, Practitioner Perspectives on the Privacy Implications of Utilizing Social Media in Mental Health Social Work. So catchy, yes, I know. But what I was wanting to get at there was something I'd personally noticed was coming up in practice, which was this slightly unspoken thing of the challenge of whether we would ever have to look at a service user's social media as part of our role as social workers, particularly in the mental health field, because it was something that I noticed other practitioners were maybe doing, but not knowing what guidance was out there. And when I looked into what guidance was out there, it was found to be very lacking. I mean, similar to what Mark said earlier, the legislation and the policy that we have is very pre-digital. So when we start to think about information sources, social media as an information source, some of the ethical stuff around that isn't quite up to date for the internet and particularly social media. And what was starting to happen as well, particularly perhaps more in children's law and things, there was a case review in 2018, a serious case review that had concluded that social media checks would help to enhance and triangulate information. So it did kind of suggest that there was an onus on workers to be accessing information if it was deemed to be public. But then we get into this sort of this rut around what's public, what's private when it comes to social media. So I mean, in terms of the actual research I did, it was just trying to break open this conversation with mental health social workers. I spoke to 10 of them about their experiences with this kind of arena, really. I mean, I referred to it as the invisible frontier because it does feel like it's this kind of Wild West where there isn't, particular laws. People are just sort of making it up as they go along. So it was about trying to figure out what's really going on the ground. And yeah, and what would justify ever looking at social media? What would prevent people from doing such? And really, it was just sort of getting into it with a lot of them. I mean, it covered a lot of ground, which is quite hard to summarize here. But there was a lot of wrestling, I suppose, internally with, what was right and what wasn't. A lot of double binds of like, well, okay, if social media, if a client's social media was public, would that then be a fair source of information? But then you would consider, are they as aware of, when they put that up, did they intend for that to be seen as publicly? And you've got this kind of rearing of the agent of the state idea of social work coming in of, if we start looking at that, does that count as surveillance? Are we, it can have a kind of chilling effect on the things people might put on social media and use it as a platform of free communication if they believe, government bodies are watching it, which, I personally kind of do veer a little bit conspiratorially toward it's quite a known fact that a lot of that stuff is being viewed, especially by private corporations and the platforms that we're putting them on. So yeah, it's kind of, where does social work find a place in that if we're trying to, advocate for people's rights in a digital space as well? So just briefly, I guess, just looking at the implications I found from my research was, firstly, that the training and the policy was lacking, essentially, for a lot of practitioners. They were finding it that they wanted a more robust framework to understand why, when, and how social media access would be acceptable or not. You know, so some of this stuff, that case review I mentioned, a little bit more interpretation of the Human Rights Act with Article 8, which gives you kind of protections to your privacy, and how social media would fit into that would be useful. But I think what was also found was that practitioners were drawing on a lot of existing guidance from other places. So when I spoke to AMPS, they were saying, you know, they had a bit more training on sort of data protection and things like this, that they would use to at least help guide what they were doing if it ever came to looking at someone's social media, especially in a case where they were trying to get information very quickly. Kind of using social media as a last resort, basically, to look at to gather information. Another thing was just sort of I came up with this concept of digital reflexivity, which is just a fancy way of saying, you know, we need to be talking about this stuff a bit more as professionals, especially within, you know, professional to professional supervision, because it was just found, especially across the range of practitioners, we've got the range of areas of mental health social work as well. Digital spaces are going to be less or more appropriate. So, you know, I was speaking to some practitioners who worked in dementia, where the service users might not be as savvy or using social media as much, but then there came like an issue of their carers might be their parents and their children and things like that. And also bearing in mind, you know, other practitioners' level of savviness. I mean, it's all very well, I'm quite young, I use social media myself, but, you know, older practitioners might not even think to do it, to look there. So trying to understand, you know, what people's literacy around it is and how that can affect whether they're using it or not, as a means of information. And I think one of the most important things, and especially more over this last year as well, one of the implications was this thing around privacy. And perhaps the first step isn't about whether or not we are using that information, but whether or not we make service users aware of their rights around it and how they can better protect themselves online, in terms of, you know, making sure they've got basic privacy controls on their social media, and also asking about social media a little bit earlier in assessments and things like this to help highlight if social media is going to be a risk factor for them. You know, so for example, if when they're unwell, they might use it in a way that when they're well, they wouldn't want to see it like that. So factoring this kind of stuff into care plans as well can help understand where practitioners stand in respect to someone's social media. And also just a bit more of a theoretical conceptual point was this idea of what is it that people put on social media and how do we interpret it? So if it is to be approached at any point as a relevant information source for risk assessment and things like this, we have to ask, you know, what does it mean when someone is using social media? Is that a true reflection or not? I mean, that's quite a trite observation, but it was just this idea of trying to conceptualize what a public self means in respect of this more traditional view of looking at like the private self, the professional self, the personal self. There's now this fourth avenue, which is the public self, which we need to start to think about. So yeah, sorry, that was a little bit scattershot, but I hope you've kind of got some of the questions I was getting at with the research, and hopefully we'll talk a bit more in the Q&A. Thanks.
Excellent. Thank you so much, Arnold. That was really interesting. And I do want to pick up immediately on one of the points that's come up in the Q&A around privacy, not necessarily for you, but for all panel members. I want to open it up now. Do you think, and this is a question for anybody to jump in on, do you think that there are any issues with using specific platforms such as WhatsApp and privacy? And are there things we should be saying?
Yeah, I mean, that's interesting. You bring up WhatsApp because there's kind of an issue of WhatsApp is like an encrypted platform. So it's generally considered to be a much safer use. I mean, it depends on what you're talking about. If we're talking about the ways we communicate with service users. So something like WhatsApp, I mean, I use that in my practice, and I think it's generally considered quite a safe one. But it's a good point, because I think when we, like Hameed was saying, there's all these different platforms coming up that we're being asked to use, and they're being chopped and changed, and it's unclear what's more secure than others. So yeah, I don't know if anyone else has anything to say.
Yeah, I mean, I totally agree with that. I think that WhatsApp is, and other ways of communicating are very good, and people use them very well. I think obviously there are risks with them, but they're the same risks that we had in terms of other forms of communication, like verbal or letter writing and things, in that we have to remain boundaried and appropriate, and we have to make sure that, I think one of the risks with social media is that it leads you to be much more informal, and therefore it's easy to slip into issues where you find yourself disadvantaged. And I know that a lot of professions look in detail at this. You know, teaching, for example, has a number of guidance documents around how to work on Facebook, and how to operate Twitter accounts in ways that allow you to have freedom of expression but don't get you into trouble. So, you know, this is something that we're engaging with and formulating as we go along, but I wouldn't want it to stop us from being able to engage with people, because I think that WhatsApp is something that enables us to talk to people in a much more informal way and in a much more regular way than perhaps we used to. So it's got huge advantages.
Thank you. There's several questions that are coming in via the Q&A now. Some of them are for individual panel members, and I would encourage you to write individual responses just so that we can get to some of the questions which require a bit of discussion. One of them here is for any panel member. Hameed has already typed an answer. How should we approach supporting service users with access to technology, specifically if this is needed to improve their mental health outcomes? Any thoughts on that?
Shall I go first?
Sure.
Yeah. So first of all, I just wanted to touch upon very briefly what Arnold said about WhatsApp. I think what we also need is a clear policy for social workers around usage of WhatsApp, because there's still a very blurred area about what time they can contact you. Is it appropriate for them to send you a message at 2 in the morning and expect you to reply back straight away? So there needs that. I just want to kind of say, as a service user and carer, we need to know what are the boundaries around WhatsApp. Secondly, going back to the question around poverty and exclusion, I think that reality is that, first of all, there's a term now that gets used called inclusion real costs. And real costs, there's a real cost to using digital platforms in terms of that we need to acknowledge, like heating, lighting, because when I'm using my room, I've got to put heating and lighting on. If I was going to a face-to-face meeting, I would switch that off. So people's cost has gone up. Secondly, around using data, not everybody probably has broadband, and there may be, I know a lady that said before the lockdown, she was using £10 a month, and now her bill has gone to £30 a month because of data. And people haven't got the knowledge that maybe they could shop for a better deal. So there's also that aspect. Second and last point I like to make is that we need, like you do a care assessment and you look at people's needs and requirements, in that there needs to be a section around digital inclusion, exclusion, however you want to word it, that says to people, how do you access digital? I have a broadband, great. I don't have Wi-Fi. Usually I go to the public place. Okay, so all these kind of questions will get you a real picture of what the person's circumstances are. And then I think if it's allowable, I'm not a qualified social worker, so please excuse my ignorance, but if you have a budget, then you should either be reimbursing people. Some organizations are fantastic. They offer £5 flat fee for covering expenses like data, heating, lighting, printing. They just give you a standard £5 fee. Some organizations haven't acknowledged that, and some people are now not engaging because of the cost involved. So always ask the service user what would cost you to get to attend your online appointments, and from that you can then make a judgment around, is there a budget of reimbursing their data costs and whatever cost is associated with their online engagement? And that's one approach. Thank you.
Thank you very much. Let's just move to a couple of other quick questions here. Jan, do you want to say something about how people can access Knack and how much they have to pay for it?
Yes. So the mainstream version of Knack, which is just kind of open to absolutely everybody to subscribe monthly, it's $23.99, but you can buy a one-off box. So let's say you only like the look of one project, that's $26.99. However, I would say what we're doing with Carers UK is because they are purchasing boxes for their membership as a group, we've done a much heavier group discount, and obviously because we are conscious of people's financial costs as well, in that kind of group that we're trying to reach, we are being a little bit less focused on the price with that grouping. So if anyone has people that they would like to look into Knack for, more than happy to have a conversation to look at pricing, because yeah, we can be a little bit more flexible about that.
Okay, that's great. Thanks, Jan. We've reached the end of our time, I'm afraid, this morning. But what I would like to encourage panel members to do is to go through the Q&A and answer any of the questions that they would like to. Continue the discussion on the Q&A in the background while we move into the next panel. But please join me in thanking our four panelists, Arnold, Jan, Hameed and Mark, for getting the discussion started this morning and raising some really, really important issues, particularly around digital inclusion, which we need to consider in social work. So thank you very much indeed.